Let's talk about pelvic pain, a little bit more difficult subject. I want to start off with interstitial cystitis. What's that?
Yeah, so chronic pelvic pain is something that so many women suffer with. And as you said, the chronic pain side of the equation can be a little challenging, but we'll talk about a few of the most common types or causes of chronic pelvic pain. So interstitial cystitis, which we now call painful bladder syndrome, is really kind of a chronic inflammatory condition, irritation of the lining of the bladder.
So there's definitely something wrong with interstitial cystitis.
Yes.
Because I've seen some people that said, well, they didn't feel like I really had anything major. It's a
Right.
major problem.
It's a major problem for so many patients, and it's a problem where the protective lining of the bladder is no longer protecting the patient. So urine, which is full of solutes like salt and sodium and potassium and urea, are like rubbing salt in the wound. And so these patients suffer with burning. It feels like they have a bladder infection all the time, sometimes blood in the urine, pain with intimacy, urgency, frequency, running to the bathroom all the time, sometimes treated over and over for what was suspected to be a recurrent infection, and yet if you culture the urine, many of these times they don't have any bacteria in there. And so interstitial cystitis is an awful cause of this chronic pain for so many women.
Where's the pain?
The pain is sort of front and center. I mean, they can feel it. It's behind the pubic bone. It's the lower abdomen and pelvis area. Another very common condition is endometriosis, one of the most common causes of pelvic pain in women. The endometrium is the lining of the uterus. When those cells are growing somewhere other than where they belong, like on the ovaries or the tubes or somewhere in the pelvis or abdomen, they can cause a lot of pain. Pain with intimacy, terribly painful periods, pain on the right, left, or all over the place. And interestingly, we know that in a fairly high percentage of reproductive age women who suffer with chronic pelvic pain, those two conditions can coexist. So a lot of those patients have both endometriosis and interstitial cystitis, and there's some real overlap in the types of symptoms that are caused, and so it can be tricky for the patient and even her physician to try to isolate or figure out what are the main issues going on.
So women frequently hide their discomfort, not because of being embarrassed, because they've got to take care of everybody and do everything. Does this almost incapacitate people? How bad is both interstitial cystitis and endometriosis to a female?
So in the mild forms, they can start out just being kind of a nuisance or an aggravation. And very often the patient will seek help several times, and as you say, sometimes patients end up suffering in silence because they have their family and other obligations and responsibilities that they focus on. But as these conditions progress, sometimes being left undiagnosed or untreated for a period of several years, either one of them can really become devastating to the quality of life of the patient.
Treatment for both pretty good?
So we have treatments available for all of them, sometimes hormone type therapy for endometriosis. Many times we have to do laparoscopic surgical treatment. For interstitial cystitis, there's a range of dietary modifications that we work with the patient on, sometimes drinking alkaline water, a variety of medications that we sometimes use, and sometimes we have to take these patients to the operating room to dilate or stretch the bladder.